When I say lead poisoning, what's the first thing that pops into your head? For a lot of us, it probably feels like a problem from the past, right? Something we took care of decades ago with unleaded gas and banning lead paint. But what if I told you that's not the whole story? What if one of the biggest environmental health threats is still out there, silently affecting millions and millions of people all over the world? Let's unmask the hidden reality of the global lead crisis. So, is it a problem of the past? Well, the answer is a huge, shocking no. We are facing a crisis on a scale that is it's hard to wrap your head around. The numbers are absolutely staggering. Let's just start with this one. 815 million. That's how many children around the world are estimated to have dangerous levels of lead in their blood. I mean, that's 1 in every 3 kids on the entire planet. 1 in 3, with levels high enough to cause irreversible brain damage. This is not some historical issue. It is a full-blown global health emergency right now. And it's not just kids who are suffering. The damage stretches far into adulthood. Lead exposure is linked to about 1.5 million deaths every single year. Most of those are from cardiovascular disease. Now, to put that into perspective, that number rivals, and in some cases might even be higher than, the annual deaths from diseases like HIV/AIDS or malaria. And if the human cost isn't enough to get your attention, let's talk about the money. The World Bank crunched the numbers, and the total economic hit from lead exposure comes out to $4.6 trillion. That is more than 5% of the entire world's GDP, just gone, wasted on a poison that we already know exactly how to get rid of. So when we throw these huge numbers around, what does it actually mean for a person? It means a lifelong burden. See, lead is a powerful neurotoxin, and the damage it does is permanent, especially to the developing brains of children. We're not just talking about statistics here. We're talking about a kid who can't focus in school, who struggles with impulse control, who has a harder time just learning and connecting with the world around them. And look, the World Health Organization is crystal clear on this. When it comes to lead, there is no safe level. Zero. None. Even tiny, tiny amounts can set off a chain reaction of developmental problems that a child will carry with them for their entire life. The cognitive cost is just devastating. Research shows that kids with high lead exposure can lose over 22 IQ points compared to other kids. Just stop and think about that for a second. Imagine what that does to a kid's future. That's the difference between grasping a new idea and falling behind, between chasing a dream and having it stolen from you before you even get started. Okay, so take that individual tragedy and now multiply it on a global scale. This is what you get: a worldwide loss of 765 million IQ points every single year. This is a direct contributor to the learning gap we see between countries. It is quite literally a drain on our collective human potential. All right, so if we got rid of leaded gasoline, where is all this stuff coming from? Well, the answer is pretty unsettling. It's often hiding in plain sight in products that millions of people use every single day. The sources are everywhere, and they're insidious. We're talking about things like spices and cosmetics that have been laced with lead, lead-glazed cookware that families use to cook their meals, water contamination, improper recycling of things like car batteries, and of course, the big one that never really went away: lead paint. These aren't some exotic risks. This is everyday life for billions of people. Get this, in some places, lead compounds are intentionally added to spices like turmeric. Why? Just to make the color more vibrant or to add weight for a bigger profit. This one thing, this single act of trying to make a little extra money, can push a child's blood lead level into the danger zone just from the food they eat every day. You know, in many wealthier countries, we think of lead paint as a problem we solved a long, long time ago. But that is just not the reality for most of the world. For billions of people, lead-based paint is still the #1 source of childhood poisoning. As that paint chips and turns to dust, kids can easily ingest it, creating this massive, unfair gap in who is protected and who isn't. Okay, I know, this all sounds incredibly bleak, right? But the story doesn't end there. Faced with this crisis, there is a coordinated global fight back that's really getting momentum, and we have a clear path forward to turn this whole thing around. And we are making progress. Thanks to the efforts of groups like the Global Alliance to Eliminate Lead Paint, nearly half the world's countries now have laws on the books to control lead paint. But of course, that also means that more than half the world still doesn't have these basic protections. So the work is far from over.
And the pace of change is really starting to accelerate. I mean, just in the last few years, we've seen new clinical guidelines from the WHO. We've seen Nigeria, Africa's most populous nation, pass a strong lead paint law. And there are major new funding initiatives getting started. This isn't some forgotten issue. Action is happening right now.
And the strategy here is actually pretty straightforward. Global partners are hitting this from three main angles. First, helping countries strengthen their regulations. Second, identifying and actually removing the sources of lead, like those contaminated spices and paint. And third, improving blood lead testing so we know exactly who's at risk and where we need to focus our efforts. So, after all that, where does this leave us? Well, we're facing a severe global crisis, for sure. But we're also left with a really clear and powerful message. This goal is achievable. A lead free future isn't some fantasy, it's a choice we can make.
You know, Dr. Rudiger Krech at the WHO put it perfectly. He said, every child deserves a future free from the lifelong harm that can be prevented. And that's the key word, right? Prevented. This isn't some unsolvable mystery. We know what lead does, we know where it's coming from, and we know how to stop it. This is about protecting the basic right of every single child to reach their full potential. So it all comes down to this one final, unavoidable question. The science is settled, the solutions exist, the moral case is undeniable. So if this crisis is entirely preventable, what are we waiting for?